Okay, so now we get to actually practice giving a drug test. Please reference handout 5 for a minute here. This is all going to help you become way more familiar with the drug testing kit and the procedure, because this is all stuff that we have to be able to teach our caregivers so that they can use the screens effectively. So, handout 5 is the frequently asked questions about drug testing and MST. And this is something that we typically go over with our caregivers. This answers most of the questions that they're going to have and will certainly increase their confidence in the testing process. The other handout that I'd like you guys to take a minute and look at with me is the handout for conducting a drug screen. This lists out step by step how you are going to use the drug kit that you have in front of you today. It is the integrated easy split key cup, and we're actually going to use it in a minute. So before collecting the sample, there are steps here that we want to teach our caregiver to take, and likewise we ourselves will take if we are teaching the caregiver how to administer. So let's review this really quickly. First, we want to take everything out of the bathroom that the youth could potentially use to change a urine specimen, cleaning solutions, any containers with water, medications, etc. Taping the water faucet is another method to ensure that the youth is not going to use water in place of urine. Place the youth's name and date on the cup. Ask the youth to remove jacket or any bulky clothes and empty pockets. Check the youth's pockets, clothing, for anything that could be used to change the test. And finally, you are going to put on disposable gloves. It's also important to have a stopwatch or some kind of watch ready, because there is going to be a 5-minute waiting period between when the test is administered and when the results will show. As far as obtaining the urine specimen, we will ask the youth to pee in the cup. With appropriate supervision, this would look like standing at the doorway, facing out, close enough to be able to hear any suspicious activity. When the youth has provided the specimen, have him replace the cap on the cup. Take the cup from the youth and place it on a flat surface, making sure that that cap is sealed really tightly. Read the temperature strip on the cup and ensure that the urine is between 90 and 100 degrees. Remember, if the urine is not in this temperature range, the youth might have altered the sample. Ask for another sample or count as a dirty urine. Place the cup so that you can view the flat side, and remove the label covering the test indicator from the flat side of the cup. So those are the steps that we take, and we're actually going to do it right now. So, who would like to give a sample today so that we can see how this works? Just kidding. All right. I actually have a sample here. It is some water. Josh, I figured you would appreciate this cup. All right. So, the first step, and you'll notice that the cup will come looking like this. It's closed. There's a key on the top. So, very first thing we do is we remove the key and we open the lid. From there, we will ask for the specimen to be delivered right in here. So, the youth will pee into the cup, and we will ask the youth to then close the lid, sealed. You'll hear it snap. That's when the youth will then return the cup to the caregiver and therapist standing outside. The key is what's then used in here to, there we go. You will turn the key, and then removing this label to expose the results. And you'll actually see I can line this up here, here is the beginnings of the reading. So we have to elapse 5 minutes here, and then the results will be readable.